Hi there. I'm sorry to wake you. I'm Doctor Shanny, okay? I'm just here to take a look at you. I got your voicemail that you weren't feeling well. I'm so sorry to hear that, but don't you worry. I'm here now. I'll take a good look at you, and we'll make sure that we get everything figured out, okay? Okay. Now, in your voicemail, I did hear that you left the door unlocked and to just come in. Yeah, you weren't feeling well and wanted to take a nap. Totally understandable. Oh yes, we've been doing at-home visits for our patients right now due to the circumstances with everything going on. It's just safer for us and for you guys, so you guys don't catch anything that might be worse than what you're already going through, okay? We have been doing FaceTime meetings and appointments and stuff like that as well. But for people who have more flu-like symptoms, we just like to make home visits to make sure you're not going through something that needs more attention, okay? Okay. So, now, I already know your name since I had to come over here, but I do need to get some more information from you real quick, okay? Don't worry. Normally I'd have you fill this out, but since you're not feeling well, sweetie, just go ahead and keep lying there and relax, and I'll get this all filled out for you, okay? Okay. Now, let me just get your first name and last name jotted down here. And what's your middle initial? Awesome. What does that stand for? Love that. Okay. And we write down your patient ID. Alright. And can you give me your date of birth? Okay. And the date today is the 17th. Okay. And your age. Okay. Alright. Now, let's get some information on your past medical history. You haven't had any recent surgeries, any trips to the hospital, or any reason to see a doctor or anything within the last few months? No? Okay. How about in the last couple of years? Have you had any big surgeries or trips to the hospital? No? Okay. And do you have any allergies I should know about? Okay. We don't need any of that. And how's your diet been? Yeah, there's a lot of things out at grocery stores, but sounds like you've been doing pretty well. Alright, that's good to hear. And have you been getting any exercise in? Yeah, I know with this situation that exercise can be a little hard, but you want to make sure you're getting up and doing some moving around and stuff like that, okay? Alright. Of course, after you're feeling better right now. So, since you're lying down, I can't get your height or weight, but why don't you just tell me, where you are in that ballpark? Okay. Okay, good, good. All right. Ear. How's your like hearing and your vision? A little blurry. Okay. Okay, we'll take a look. Okay. Hearing's been fine. Okay. Now, did you get your flu vaccine? Mm-hmm. Okay. Alright, and we said nutrition's been good. Have you been smoking or drinking or using recreational drugs? Okay. And have you been sexually active? Okay. We just need to ask just to make sure we have all our information up to date here. We got physical activity. Okay. Now, how have you been feeling? Like your symptoms? Okay. So you have a headache, some sensitivity to light. Okay. Feeling nauseous. Have you had any vomiting or anything, or just nausea in general? Okay. Have you been good on getting anything in your system fluid-wise, drinking a lot of water? Okay. That's not bad, but you want to make sure that every time you throw up or anything like that, you're losing water and hydration. So you want to make sure that you're taking in much more than you're letting out, okay? So while that's decent, I'd like you to try to drink a few more glasses of water a day, okay? Alright. And have you been able to keep anything down food-wise? Okay. Alright, and you're having some chills. Do you know if you have a fever? No? We can take a look at that. Alright. Okay. I think I got everything I need to start. If you think of anything else, please let me know. Or if you have any questions, go ahead and stop me and ask, okay? Alright. I'm just going to start by sanitizing my hands. I want to make sure we keep things nice and safe for you. Okay. Okay. Now let me just get on some gloves here. You don't have a latex allergy, do you? Okay. I just want to start by getting your temperature. So I have this thermometer right here. And it's been disinfected, so don't worry. I just want you to open up your mouth really big. I'm going to stick this under your tongue. You're going to close, and we're just going to wait for it to beep, okay? Alright, here we go. And close. And let's wait a little. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Here we go. Alright. It is a little high. It looks like you're at 100.7. We definitely want to try to get that down for you. I'm just going to write that down. Okay. Alright. Now, fevers are an indication that our body is trying to fight something off, which we can definitely see that you're not feeling well. So, typically I'd say with like 99.9 or even 100 or like to 100.2, you'd be okay to kind of try to sit that fever out and let your body fight that off, but you're very close to 101 and that's a little high. So if you're feeling a little too sick or a little too warm, you can go ahead and take a warm bath to try to bring that fever down. No, you don't want to take a hot one, obviously, because you're feeling warm. But it's actually a myth to take a cold bath because that'll shock your body and it could make it worse. So you'd want to take a warm bath, okay, sweetie? Or a warm shower is fine too. I just thought a bath might be a little more relaxing for you, okay? Alright. Or you can take some Tylenol to try to bring that fever down a tiny bit. Okay? Okay. Good. Next, I just want to listen to those lungs. So, do you mind pulling the blanket down a tiny bit? Thank you. And I'm just going to have you lift up your shirt a tiny bit. There we go. And I know breathing might be hard, but could you try to take a couple big, deep breaths in for me? Thank you. All right, here we go. A few more for me. Okay. Okay. That's very good. Your lungs sound fine. It sounds like that you may have some slight coughing or congestion, that your breathing's actually fine. You're getting in enough oxygen, so that's good. I know having flu-like symptoms can cause our chest to feel tight and maybe make us feel short of breath, but don't you worry, you're getting in plenty of oxygen from what I can tell. Your blood pressure did sound a little high. You could kind of hear your blood rushing in there, but that's probably just because you're not feeling well and you're nervous and stuff. Don't worry. You don't have any history of high blood pressure, so I'm not worried about it. Okay. But I just want to verify what I heard, if that's okay. So I'm just going to take your blood pressure real fast, okay, sweetie? Alright. Just gonna put this around your arm. Alright, here we go. Okay. I was right, it is a little high. You're about 125/86. So it's not too bad, but it's definitely on the higher side. So we'll just keep that in mind and try to get you calmed down and back to bed, okay? Alright. So let's just take a quick look at you. Alright. I just want to take a look at your eyes. So stare directly at me and try not to move your head or your neck. And try not to blink or move your eyes, okay? Alright, here we go. Okay. Looks good. Other eye. Good. Okay. Alright, your eyes seem to be dilating fine. I'm just going to have you follow the light with your eyes for me real quick, okay? You know the drill. Here we go. Okay. Doing good. Okay. Excellent job. Alright. You said your eyes were feeling a bit dry. Okay. I have some eye drops here. I'm just going to put a couple in your eyes. And I'll leave these with you because I have plenty. And you can just put a couple in each eye anytime they're feeling a little dry, okay? It's just some saline solution. So here we go. Alright. Go ahead and blink for me a few times to get it in there. Alright. Just clean it off around your eyes there. Now, does that feel better, sweetie? Good, I'm glad. Okay, so let me just take a quick look in your ears. Let's see here. Everything looks good in there. I'm gonna say some numbers and you just tell me what numbers I'm saying, okay? 7. 7, good. 32. 32. 48. Good. 85. Good. Nice job. I didn't see any problems there. I'm going to check the other side, okay? Alright. Everything looks good in there. Again, I'm just going to say some numbers real quick and you can say them back to me. 45. Good. 28. Good. 16. Good. 94. Good job, sweetie. So far I'm not seeing anything of concern with your eyes or your hearing. Let me just take a quick look in your mouth. Go ahead and open up real wide for me and stick out your tongue as far as you can and say real big for me. Okay? Can you try to keep your tongue a little more flat? And alright, good. Good. I didn't see any like white nodules or anything like that would be of concern. So it doesn't look like you have strep or anything like that. So that's good. Is your throat bothering you at all or anything like that? No? Okay. Alright. Now, I'm just going to want to do some quick feeling around and just see how everything is, okay? Alright. I'll try to maintain some space, but just want to make sure that everything feels good. Alright. I'm just going to do some slight pressure. Let me know if anything hurts or makes you uncomfortable, okay? Alright. Good. Good. Okay. Alright, that all feels good. Thank you. Alright. I didn't feel any swelling in your lymph nodes or anything like that. Your skin looks good, maybe a little pale. You said you had a headache, but your eyes seem to be good, just a little dry. Ears are fine. Some slight congestion, but not too bad. Throat looked good. Nodes are fine. Lungs are good. Alright. We had a slight fever. Alright, sweetie. I have everything that I need. And it looks to me that you just have a flu, okay? And I don't just mean a flu. I know that they are bad, but nothing to worry about, nothing to be concerned about. It should be gone in 7 days tops, though sometimes it's just like 3 days at the most, okay? Alright. I want you to drink plenty of fluids, and when you're starting to feel a little less nauseous, I want you to try to eat something and keep it down, okay? Something bland. You could do like toast, maybe some chicken, something that you can keep down. Rice is a good one as well, okay? Alright. Do you have any questions for me? If you start to feel worse or if you have any questions, we do have our nurses line, and if they can't answer the question for you, they'll direct it to me and I can call you at any time, alright? Okay. Now, I just want you to try to get some sleep for now. And then, if you're feeling worse, just give me a call. Alright. There's nothing you can take since it is viral, but I know it feels bad right now, but I promise you you'll be feeling better soon. When did this start? A couple days ago? Alright, well, you're almost over the worst of it, so everything's gonna be okay. Don't stress anymore. Just close your eyes and try to get some sleep, okay? Alright. Sleep well. Good night.